for more than 3 weeks.
In my own case, I believe I attended a funeral, and I believe that is where I got it. I was very careful, but you can't be too careful in a gathering.
Yes. Having gone through this difficult condition, he advised Nigerians to keep themselves away from getting infected.
And make sure that we don't encourage gatherings. People should make sure that they always wear their face mask.
Seeing, they say, is believing, and he who feels it knows it better. In Kano, Abdullahi Mustafa, NTA News.
The live over TV journalist there. Many thanks, Abdullahi. From Kano, we go to Benue State, where the Executive Council has keyed into the Presidential Task Force on COVID-19 Phase 2 ease of lockdown by opening up churches and mosques as well as markets. Governor Samuel Otom, who announced this at the Government House, Makudi, said all protocols of the National Center for Disease Control against the spread of the pandemic must be complied with. Charles Abba reports.
Ease of some measures of the partial lockdown in Benue State is on the heels of the Presidential Task Force Phase 2 relaxation of the directives by opening churches and mosques Monday. Governor Samuel Otom, who announced that the state government is keen into the federal government resolution, disclosed that the state has 8 cases of the virus at the moment.
And in conformity, therefore, the following are pronounced. Churches and mosques, no service should last more than 1 hour. So the issue of social distancing must be observed. People congregating in mosques or churches must wear face masks. Markets will now be open subject to observance of all relevant protocols of National Center for Disease Control.
The governor, who maintained that schools and interstate travels remain closed, relaxed the existing curfew from 8 p.m. to between 10 p.m. and 4 a.m. Meanwhile, the state chairman, COVID-19 committee, and Deputy Governor Benson Abono says 16 young men who came into Benue Wednesday have been tracked, 3 of which are Nigerians, 9 from Bauchi, and 4 traders from Benue. He added that the committee has taken delivery of over 50 trucks of palliative items donated by individuals and corporate bodies for distribution to the less privileged in the state. In Makudi, Charles Abba, NTA News.
And the Kogi State Governor Yahaya Bello on Monday ordered a 2-week lockdown on Kaba Bunu local government area in the state following the NCDC report on COVID-19 index case. With the lockdown in place, residents are appealing for palliatives to cushion the effect. Jonathan Omajali has more on the situation report.
It will be worthy of note that on the 27th of May, the NCDC confirmed 2 cases of COVID-19 in Kogi State. The report, which Kogi State government refuted, saying the process never went through lay-down process of the NCDC. The action of the state government ordering the lockdown is to ensure the people in the area are strictly monitored and protected against the spread of the virus, while trying to further verify the claim of the NCDC regarding the 2 identified COVID-19 cases from the area. Kogi State government, on its part, made proactive effort to reach the authorities of NCDC over the cases as identified by the organization, but proved abortive, and has since then rejected the results.
Notwithstanding the regrettable opaqueness enshrouded in the process of the NCDC declaring these 2 numbers for Kogi State, the Kogi State government persuaded that prevention is better than cure, made the choice to put aside her doubts and quickly kicked in.
Meanwhile, security operatives have been directed to enforce the 14 days total lockdown starting from midnight as the state prepares to send palliatives as efforts to cushion the effect of the order while preparing to follow issues surrounding the alleged emergence of COVID-19 to a logical conclusion. From the Government House, Lokoja, Francis Udojo, NTA News.
Still on COVID-19, the Ekiti State government has called for cooperation and support of residents to stem the spread of the coronavirus pandemic. Commissioner for Health, Dr. Mojishola Yaya Kolade, expressed concern as the state records 5 new cases. Kola Adebobui reports that a molecular laboratory has also been inaugurated to enhance the fight against COVID-19.
The government has been battling with the stress and fund of taking the samples for COVID-19 tests to nearby Ede in Osun State, Lagos and Federal Capital Territory, FCT, even with over 200 tests carried out so far in the state. This, the state government says, necessitated the procurement of the molecular laboratory equipped with vital testing instruments and biosafety materials to support COVID-19 testing to save lives of Ekiti people from the pandemic. Some of the notable members of the state COVID-19 Response Resource Mobilization Committee, including its grand patron, Riafe Babala, commended the acquisition of the laboratory.
As a government, we remain resolute in ensuring that the residents of the state are protected.
The 3 patients that are currently infected, they have comorbidities. When we say comorbidities, they have other medical conditions.
Meanwhile, as a means to cushioning the effects of the COVID-19 lockdown, the National Youth Service Corps, NYSC in Ekiti State, has extended hands of fellowship to some residents of various communities in the state with presentation of food items and face masks, as well as sanitizers to the people.
We can assist by giving out a little of what we have. We share it with the public. NYSC cares about the people.
They were also sensitized on the precautionary measures against COVID-19 in Ado Ekiti. Kola Adebobui, NT News.
The National Orientation Agency has commenced motorized awareness campaign to check further spread of COVID-19 in Imo State. Kingsley Ononiwu reports that the campaign is aimed at communicating government policies and activities towards eradicating coronavirus pandemic in the country.
Virus is on any surface. Once you touch that surface, make sure you use alcohol-based sanitizer to clean your hands.
We want to rid our state of COVID-19. We want every citizen of Nigeria to be responsible. We want every citizen of Nigeria to help to contain the spread of COVID-19.
I'm advising people to take the fight against COVID-19 seriously. The truth is that it's real.
Personally, the virus exists, but people in rural area are careless about believing that it existed. So I want the agency to go into rural area.
And the COVID-19 rates on the increase, so also are the strategies employed to tame it. While government at all levels battle the pandemic, civil society, faith-based groups and institutions are providing the needed reinforcement in the front lines. The latest is the unveiling of a COVID-19 Situation Report and Research Center in Abuja. Benny Adams has more from the Situation Room.
With the gradual easing of lockdown across the country, there is a growing apprehension on the balance between health and wealth. While some are still of the view that the virus does not exist, a cross-section believes the virus has different mutations.
If what we have in Nigeria is a different species of COVID-19, then there must be a different drug that could tackle it.
This is a war room with members of concerned civil society and faith-based organizations, institutions, academics, and individuals as willing soldiers, providing reinforcement in the fight against COVID-19. Onwubuya John is leading in the trenches and confident that the Situation Room and Research Center will collect and collate data from all the 774 local government areas of the country, with a view to identify research needs, expand opportunities for research collaboration in finding solution to COVID-19.
Those of data will collect what we have seen. So this will empower us to tell Nigeria this is what we have seen, this is what we have found out.
There is also some fighting talk from elder statesman Buba Galadima.
Governors who stop testing of this COVID-19 is an act of criminality and calls for impeachable offense. You can't deny your citizens that.
Increased testing and sensitive weighing of the imperatives for economic growth and the general well-being of citizens are some of the recommendations given by the group. Benny Adams, NTA News.
This is Nationwide on the NTA. We take some messages now. More reports shortly.
I wish to once again commend the frontline workers across the country who, on a daily basis, risk everything to ensure we win this fight. For those who got infected in the line of duty, rest assured that government will do all it takes to support you and your families during this exceedingly difficult period. I will also take this opportunity to assure you all that your safety, well-being, and welfare remains paramount to our government. I am using this opportunity to express our deepest condolences to the families of all Nigerians that have lost their loved ones as a result of the COVID-19 pandemic. This is our collective loss, and we share your grief.
We have observed the lockdown. We have practiced the measures in order to curb the spread of the virus, but we can do better. The coronavirus spread is increasing daily, and only together can we cut down the numbers and defeat the spread of the virus. Remember, COVID-19 is not a death sentence, and a recovered patient cannot spread the disease. Do not stigmatize. Do not hesitate to report any case, or if you have come in contact with anybody that has been infected with COVID-19. If you have cough and fever, please stay at home and call your state hotline. Find state numbers at www.covid19.ncdc.gov.ng. Remember, it is for your own good and for the good of every Nigerian. Let us do better and defeat the virus. Together, we can do this. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
This is a very important message. Operation wear your mask, especially for people who don't old. No forget, your body no tranga like before. You not even tranga like your children or your grandchildren. So therefore, always wear your mask for this pandemic period. No they to receive visitors, so even if not your grandchildren. Make extra mask where you go fit wash, make like 2 and dash your neighbor 1. And if they come out for house, wear your mask always. And if you come back, wash your hand with soap and running water. To avoid coronavirus, make you for live long for your children and your grandchildren. No forget, Operation wear your mask, especially for people who don't old. Protect me, I protect you. Na coalition of societies for the right of older persons in Nigeria, COSROPIN, join body with National Orientation Agency, NOA, bring on this message.
There is a lot of fake news and report circulating, especially on social media, on the coronavirus. Do not believe or partake in the spread of these fake reports. If it is not on the official website or news from the Nigerian Center for Disease Control, NCDC, disregard such report. Only together can we beat this virus. Only together can we overcome this pandemic. Follow the instructions and guidelines provided to combat this virus. Most importantly, stay at home. Self-isolate, regardless of your status. The virus doesn't move unless we move. Let us work together to better Nigeria. Together, we can do this. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Thanks for rejoining us, and we take you straight to our Lagos Network Center where Dotun is on standby. Dotun, it's your turn.
Thank you, Awa. The Nigerian Institute for Medical Research is working towards a vaccine and cure for COVID-19. Hinginu John Adams reports that the institute is also developing a molecular test kit to further enhance trials across the world.
No doubt COVID-19 has overwhelmed the world. Nigeria's Apex Medical Research Institute, one of the testing facilities in the country, is unrelenting in researches towards silencing the deadly COVID-19. The Director General, Professor Tunde Salako, says his team of researchers are working round the clock to achieve a possible vaccine.
What we are doing currently is to look at the recombinant methods of producing the vaccine. Since we have sequenced the virus, we have capabilities to determine the spike protein of the virus and then see if we can clone that. So we are in the process of trying to clone.
Dr. Muina Fawara is a research fellow, Molecular Biology and Biotechnology Department, NIMA. She spends hours in the laboratory with just one aim: crushing coronavirus.
We also started working on formulating an RNA extraction kit, and because of the COVID-19 we had to speed that up, and I'm happy to say that about a month ago we tested that as well, and it already works. We were able to, the institute was able to identify or detect COVID-19 using the RNA extraction kit for RNA extraction.
There's a utility we are trying to make, something that will be useful to take out beyond all of this infrastructure, to take it to a side lab or a field somewhere and test people for COVID.
As work continues at this facility, Nigerians will be looking up to Dr. Fawara and her team from NIMA for a possible vaccine. In Lagos, Hingino John Adams, NTA News.
The federal government is re-strategizing to increase its natural gas reserves, guarantee investment, as well as make the sector more attractive for indigenous and international participation. Imolayo Tokede, who attended the virtual meeting where the Department of Petroleum Resources, DPR, declared the gains of the federal government in the sector, gathered that the nation's natural gas reserves surged by 3.16 trillion cubic feet in January 2020 against 2.10 cubic feet recorded in 2019, now reports.
Nigeria remains the largest oil and gas producer in Africa. Figures by the Department of Petroleum Resources, DPR, shows a decrease in crude oil and condensate reserves of 36.89 billion barrels as at 1st of January 2020 against 37 billion barrels in the previous year. The natural gas reserves, however, increased to 203.16 trillion cubic feet against 201 trillion cubic feet in 2019.
The target for crude reserve actually is 40 billion barrels, while the gas reserve, we have two targets. One, by 2025, we want to see the gas reserve to grow to about 210 trillion cubic feet, while by 2030, we want our gas reserve to hit 220 trillion cubic feet.
For improved productivity and accountability, more strategies are being implemented in the oil and gas sector.
The routine surveillance report and online display that we do have help us to check per second basis, and the production and export reporting that we generate from this data help us to track the volumes from wellhead to flow station to terminal for export.
The newly launched 2020 Marginal Fields Bid Round for 57 oil fields is also approved that Nigeria is ready for more business in the oil and gas industry. In Lagos, Imoliayo Tokidi, NTA News.
To rid Lagos State of criminals and enhance its security architecture, most especially at the community level. Lagos State Governor Babajide Sanwo-Olu has inaugurated the State Community Policing Advisory Committee and State Community Policing Committee at the Lagos State Government House, Ikeja. Nosa Usla reports that the State Advisory Committee on Community Policing is chaired by the Oba of Lagos, Oba Rilwan Akiolu, with the Commissioner of Police, Akim Odumosu, as co-chair.
Members of the committees comprise all heads of security agencies in the state, religious and community bodies, and representatives of various interest groups. Governor Babajide Sanwo-Olu stated that the inauguration of the committees was a testament to his administration's belief in community policing. He noted that community policing would take the stress off the police and give residents a sense of responsibility. Advising that every member must make it work, the governor charged each and every one of them to serve and fulfill their responsibility with transparency and diligence in making the state a no-go area for those bent on thwarting peace and security.
One of the inadequacies of our current policing system has been the inability to tap the knowledge and intelligence that exists at neighborhood and at community levels.
The Inspector General of Police, who was represented by the head of training Force Headquarters, Davis Folawiyo, said community policing is a joint responsibility, hence the need to involve members of the society. In Lagos, Nosa Osula, NTA News.
And that's it from here. It's back to Awa in Abuja for the continuation of the news.
Very well, Dotun. And back here in Abuja, the federal government is set to commence the implementation of the Mechanized Agriculture Revolution program in the country, tagged the Green Imperative. Information and Culture Minister Lai Mohammed said it is part of the present administration's deliberate policy of ensuring that the sector is made viable. The minister said this at a media briefing in Abuja, over now to Anthony Forsen.
The Information and Culture Minister, Lai Mohammed, explained that the Green Imperative Program is a Nigeria-Brazilian bilateral agriculture development program. The scheme is an outcome of Nigeria's decision to enroll in a government-to-government More Food International program. The $1.2 billion program will be funded by the Brazilian Development Bank.
The program will import completely knockdown parts of about 5,000 tractors and numerous farming implements.
Similarly, 662 local governments have been programmed for the mechanized service scheme to be operated by the private sector. Lai Mohammed added that the scheme will create about 5 million jobs as well as create a sustainable supply chain of agricultural raw materials for large manufacturing companies.
This will create 774 service centers nationwide to mechanize our farming methods and process or add value to farm produce locally, leading to efficiency and eliminating post-harvest losses, thereby cutting down cost of food all year round.
On his part, the Minister for Agriculture, Sabo Nanonu, chronicled the gains derivable from the mechanized agri-revolution.
This mechanization is going to affect 632 local governments across the country. And there will be accompanied to that 140 processing centers. These processing centers will be designed in such a way that clusters of local governments, maybe in 5 or in 6 or in 7, that are producing common products, will have a processing center for that common product to process for local consumption and to process for export.
With all plans and negotiations completed, the scheme, the Agri Minister assured, will take off soon. In Abuja, Anthony Forsen, NTA News.
And I understand the PTF daily briefing on COVID-19 is about to commence. We'll now hand you over to the proceedings there.
Ask first. members watching this program from home and from their offices, gentlemen of the press, good afternoon. I welcome you to the national briefing for Thursday, 4th of June, 2020. This afternoon, we'll be maintaining our format. We'll have the chairman of the Presidential Task Force take his remarks, after which we'll take technical updates. If there are updates from the various sectors, we'll take such updates before we take the questions from you. So let me now invite the chairman of the Presidential Task Force on COVID-19 and Secretary to Government of the Federation to please make his remarks. The SGF.
Members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, let me once more welcome you all to the national briefing for Thursday, 4th of June 2020. The Presidential Task Force has continued to observe the takeoff of Phase 2 and implementation of the additional guidelines nationwide. State oversight of this phase of the response is very critical. The response needs to be decentralized to the local government level, identifying high-burden local governments and ensuring mapping of adequate support to rapidly trace, test, and treat cases. States need to drive aggressively campaigns to engage communities in order to address behavioral change and debunk misconceptions and stigma. Traditional and religious institutions have a role to play in sensitizing communities about COVID-19. In the last couple of days, the Presidential Task Force has received inquiries on some aspects of the guidelines issued. However, I wish to inform all Nigerians that they have been simplified as much as possible, and the dissemination has already commenced through the electronic and print media. The National Coordinator will continue to elaborate on the guidelines as frequently as possible. As we approach the weekend, we remind the public to be aware of the guidelines set for restricted opening of places of worship, national guidelines that have been shared with the states, and we expect that protocols will be agreed with our religious leaders where states have permitted the issuance of those protocols and the setting of the relaxation on places of worship. Compliance at this stage is important so as to avoid unwarranted consequences that put the lives of people at risk of contracting COVID-19. We urge for utmost caution at all times. The Presidential Task Force will continue to monitor the overall compliance of the easing of restrictions as well as evolution of any outbreak. However, we will not hesitate to review as we progress should the situation warrant to avoid preventable risk of transmission. You will recall that the hydroxychloroquine in the ongoing Solidarity trial on effective treatments of COVID-19 was temporarily halted by the World Health Organization on the 25th of May 2020, pending review of all safety data by the Solidarity Trial Data Safety Monitoring Committee. The World Health Organization, as part of the efforts to find a cure to the COVID-19, has resumed the inclusion of patients in the hydroxychloroquine arm of the study. The Presidential Task Force, however, advises against self-medication in all circumstances. As we have always urged, it is important for individuals to take responsibility. As we go into community engagement, citizens should cooperate with agents of the state governments, the local and community authorities, as well as their leaders in their communities. We have received reports about citizens refusing help with contact tracing, as well as going into isolation after testing positive. It is in the interest of everybody that contacts are traced so as to slow down the spread. It is also in our interest to go into isolation facilities for close monitoring. A number of attacks have been recorded due to change in the condition of patients while staying outside the isolation facilities. Our appeal is that if agents of the state get in touch with you regarding testing, contact tracing activities, please cooperate with them. Also, let's be prepared to be quarantined and to monitor our health for onset of symptoms, because it is important for us to break the chain of transmission and prevent the further spread of COVID-19 in our dear country. Earlier in the week, we raised the red flag and enumerated our efforts to cut down the rate of infection among medical workers. The Nigerian Center for Disease Control is stepping up training on infection, prevention, and control to slow this emerging situation down. Land preparation and planting of crops. To guarantee a seamless flow of agricultural activities, the guidelines have exempted the agricultural value chain from the restriction put in place. It is therefore important that we do everything possible to guarantee our food security by supporting our hardworking farmers to function. I therefore appeal to all our various task forces and security personnel at the subnational levels to ensure easy passage of these inputs to our farmers. Ladies and gentlemen, I'm pleased to inform you that we have continued to receive support from our development partners. Yesterday, the International Atomic Energy Agency delivered test reagents, kits, and a PCR machine in our effort to combat COVID-19. We are appreciative of this venture and note that the equipment will go a long way in boosting our laboratory capacity and testing of infected persons. I now call on the Honorable Minister of Health, the DG Nigeria Center for Disease Control, and the national coordinator to update you before we take questions. And I thank you for your patience and for listening.
Good afternoon, everybody. The chairman of PTF, honorable ministers, permanent secretaries, directors general, ladies and gentlemen. Building on the speech just given by the chairman, I will first of all start by saying that Nigeria currently has crossed the 1100 line and has a total of 11,166 confirmed COVID-19 cases in 35 states and the Federal Capital Territory, of which 3,329 have been treated successfully and discharged to their homes, while we have sadly recorded 315 fatalities. The daily epidemic curve of confirmed cases shows a consistently rising trajectory with corresponding increase in fatalities, but it's not comparable with what is observed in some foreign countries. But to rest on our oars for that reason will be a serious mistake. COVID is real, and we have explained that the increase in cases is due to improving testing capacity and also activities in other pillars such as surveillance, community mobilization, coordination, contact tracing, and also aspects of demographics and other not so very well known factors. The team from the Federal Ministry of Health that was deployed to Lagos and Ogun State, led by the Executive Director of National Primary Healthcare Development Agency, has returned. And I also want to use this opportunity to thank and appreciate the Nigeria Air Force. They have supported us in all our movements. At every instant, they have made transport available, and they have never said to us that they can't. I want to thank them in the name of all Nigerians. The team returned with optimism, but having gained a better insight into the state-specific challenges and gaps where they visited. And they had audience with the executive governors, visited the state EOCs, and exchanged ideas with state health teams. A full report of findings will be ready next week, but preliminary findings are the same as we found everywhere, that the treatment of routine and essential cases has dipped a little somehow because of fear of COVID and also because of less patronage by persons who are afraid to go to hospital. But in the team were also a good number of people from Primary Healthcare Development Agency, Department of Family Health, Department of Hospital Services, NCDC, who were able to interact with all the counterparts in the states to develop a very good professional handshake. We are optimistic that the benefits are going to be seen very soon. The Federal Ministry of Health team to Kano, Sokoto, Jigawa, Borno, Katsina, and Gombe will be submitting their final report in a presentation to the Ministry of Health tomorrow. We shall share the results with you later. But the preliminary reports also show that the goals of the intervention were met. On Tuesday, the 2nd of June, I had the privilege of chairing a virtual meeting of ECOWAS COVID-19 Ministerial Coordinating Committee on Health, hosted by the West African Health Organization and attended by 15 ECOWAS ministers of health, and a few of them were represented. This is the first time West African ministers of health are meeting virtually, but they had met earlier in Bamako a few months back, and the Honourable Minister of State was at that meeting. This Committee on Health is one of 3 committees. The others are committees on finance and transport of the ECOWAS region, and they were set up to facilitate the work of the ECOWAS COVID-19 response champion in the person of His Excellency President Muhammadu Buhari, who was elected into this role on April 23rd, 2020, at a virtual meeting of ECOWAS heads of state and government. The attempt of West African leaders to address this common problem. At the meeting, we compared notes, discussed matters of regional cooperation and collaboration around COVID-19 strategy and response. We also discussed border-related challenges on movement of people and goods when borders are reopened. West African Health Organization and Nigeria are presently working together on a cost-sharing plan for a common air transport aircraft to convey COVID-19 supplies belonging to WAHOA to Nigeria from Beijing to Abuja. I also had the honor of presenting the statement of His Excellency President Buhari at a virtual global vaccine summit this afternoon, hosted by UK Prime Minister Mr. Boris Johnson. And the purpose was to mark 20 years since Gavi was founded. Gavi is a global alliance for vaccine and immunization. And the purpose of the meeting was also to raise funds to support the activities of providing vaccines to low-income countries. Just as we continue to engage states, we shall also continue to engage communities, religious and traditional leaders for sustained messaging to citizens. Also on the importance of adhering to health advisories to combat community spread of COVID-19. I again emphasize that much at this stage depends on a trust-based partnership between people and government to faithfully obey the rules on COVID-19 as laid down for our own common good. Support to our states will be tailored to the challenges and strengths of their health systems. The National Primary Healthcare Development Agency is discussing options and guidelines of supervised out-of-hospital isolation and care with some states, which is either home-based care or based in communal space, like school dormitories, since schools are presently closed down. As we continue to engage states on scaling up sample collection and testing capacity all over the country, we also continue to urge healthcare workers to ensure that they are protected with appropriate personal protective equipment and continue to exercise a high index of suspicion when treating patients. This is not the time to be careless. This is not the time to take risks. But it is also a time to listen to all patients, not to send people away. You can give them at least an advice. And if you are at safe enough distance, you will generally also be safe. To comment on the various test kits that are thought to be in use in Nigeria, especially the antibody-based test kits, I would like to advise that only 4 of those kits have been evaluated by the Medical Laboratory Science Council of Nigeria, and all 4 of them failed the validation test. None of the antigen test kit has yet been evaluated. But what it means is that results obtained from these test kits, they're not tenable for diagnostics. and they are deficient in sensitivity and specificity and are likely to give false results and mislead people. NCDC certified laboratory in Nigeria is still the WHO recognized PCR testing method, which gives us reliable results. Though expensive, this option is the right one. And right now we have over 30 laboratories in the network. And as you heard just now, one PCR machine just came in. And the aim is to establish at least one laboratory in every state, at least. So I would like to advise again all citizens to please put on your mask for your own safety and your own protection, and for the protection of others. This is one of the few easy steps that we can take to protect ourselves, particularly when we are in a crowded environment. We know that physical distancing is not always feasible, it's not always realistic to be expected. Therefore, you need a barrier of this nature as a minimum protection, but not the only protection, not the sole protection. We still encourage distancing as much as possible, the use of sanitizers, hand washing, open your window for fresh air wherever it's safe for you to do so. And also wear your mask even inside your house if you are not sure of the COVID-19 status of people you are living with in a locked environment. And remember the respiratory hygiene, the use not to cough into the open space, but to use tissue or a handkerchief. Thank you very much for your attention.
Chair of the Presidential Task Force, Honorable Ministers, gentlemen of the press. My comments will be very brief. Last week I mentioned that we're working on new case management guidelines, so we've now published the third version of our case management guidelines on the NCDC COVID-19 website. Like I said, there has been new science emerging about the duration of infectivity of individual patients, one that themselves infected, which led to the WHO issuing new clinical guidelines. We then convened colleagues across the organization, across the Federal Ministry of Health, with the case management lead, the Department of Hospital Services, in the Federal Ministry of Health, as well as other colleagues with whom we work, to review our guidelines and issue new guidelines for the country, of course adapting it to local circumstances. Now, the key thing is that the management of COVID-19 remains primarily supportive. We don't have any treatment so far that has any proven impact on mobility. So the 5 general areas of management are supportive management of the symptoms the individual has, managing whatever pre-existing conditions, supplemental oxygen therapy to different extents, treatment of bacterial infections. So very often when you have a viral infection, you are liable or you are susceptible to a superimposed bacterial infection, and ensuring that patients are well nourished and well hydrated. So in practical terms, what does this mean? One of the major changes that has happened is the discharge criteria. Now, while these guidelines are obviously primarily targeted at physicians managing patients, it's important that patients themselves know and people know, because this is a disease that really we're all involved in collectively learning in real time and managing ourselves and managing society. So the two critical groups of patients are symptomatic patients and asymptomatic patients. So for symptomatic patients, they may now be discharged 10 days after symptom onset, at least 10 days after symptom onset, and at least 3 days without symptoms. So if you're symptomatic, you can be discharged if you have had 3 days without symptoms, in addition to at least 10 days of symptoms. Of course, if your symptoms last for longer, we will wait for longer while managing you supportively, like I said earlier. If you're asymptomatic, we can discharge you. You can be discharged 14 days after your first PCR positive test. So we no longer have to wait for a negative test to discharge. You can be discharged 14 days after your first positive with confidence that you can go home, that you're no longer infective, and you're not at risk you're not putting your family, your friends, or anyone else at risk if you're asymptomatic. So these have come out of science. We're confident on its impact. Change is difficult because we've been saying you have to have a negative test. So even though we've published these results, many physicians are still hesitating to use them, but we can assure everyone managing cases that 14 days after, in fact 10 days is what the evidence says, but we've added 14 days to make it a neat 2 weeks for people to then implement discharge for patients that are asymptomatic. In addition, we have also removed the use of antivirals from our treatment guidelines. Like the Honorable Minister just said, the trials for chloroquine and hydroxychloroquine will go on, and we have no problem with that. But we are asking that we restrict the use of these medicines to those trial settings and not use them casually around the country. So if you want to, let's restrict the use of chloroquine, hydroxychloroquine, and all the other antivirals previously in our guidelines to contexts where clinical trials are going on, so that we don't use things that we're not sure about their use. So that's the second major change. The third one is more for us. We've clarified how we define a death from COVID-19 so that the reporting of this is more straightforward and standardized across the country. So in conclusion, these new guidelines are on our website. We've already distributed them to all commissioners of health, all CMDs of tertiary hospitals, all state epidemiologists, all incident managers across the country. But we know we can't reach everyone, and we have to reach as many people as possible. So we're really encouraging all the physicians watching this to download those new guidelines. We don't print massive copies of them because this is a new disease, and it's likely that we will keep learning. This is the third version in 3 months. So we have not spent a lot of money printing guidelines. We advise you download them from the website. You can print them for your own hospital, but don't print too many. We will, or print as many as you need in your own context. We will keep reviewing, not just us, but the global community. Everybody is learning at the same time and offering Nigerians the best evidence possible and the best support they need to manage cases. So I really want to thank everybody that has been part of the review process, especially the Director of Hospital Services, my sister Dr. Debbie Abebimpe of the Federal Ministry of Health, and many other friends, collaborators who worked tirelessly to get this document out on time so we can use it to manage our patients more effectively. Thank you very much.
The Chairman, Presidential Task Force, Honorable Ministers, members of the PTF, gentlemen of the press, good evening. First of all, I would like to briefly talk about the impact of COVID-19 on our health services, both in terms of the quality and also access to care. As you're aware, the whole world has engage in an unprecedented response against this virus and against the disease, and quite rightly too. However, as a result of this, we are seeing a situation where other health conditions are not, health services are not concentrating on other health conditions. If anything, the emergence of COVID-19 has led to the detriment in terms of care for other essential health services. And this negative impact included reduction in health services that could arise from disruptions in medical supply chains or the availability of human and financial resources. And also in a decline in people accessing healthcare simply because of fear of getting infected by COVID-19. We've also seen reduced access to healthcare for medical diagnosis of other conditions, and for the most vulnerable populations like children, the elderly, and those with underlying illnesses such as diabetes. As I've said in the past, if you have fever today in Nigeria, it's far more likely it's going to be due to malaria than due to COVID infection. And people need to be able to access care. We have been observing a steady rise in maternal and child mortality as a result of disrupted essential services. We've also seen life-saving maternal, newborn, and child health services, routine vaccinations, access to care for chronic conditions such as HIV, and other treatments not being delivered in our hospitals. We are also seeing diversion of certain products like second-line HIV drugs, for instance, lopinavir, ritonavir, that's being used for HIV treatment. That's currently being used for COVID infection. And as mentioned by the DG NCDC, we are asking health institutions to make sure that they have proper assessment processes for people presenting with possible COVID. They must have holding areas and screening areas so that their staff can protect themselves and at the same time be able to deliver care. Hospitals are there to look after patients. Hospitals are not there to turn patients back. People should not be allowed to suffer or die because of COVID infection. We must not allow preventable deaths to occur in our communities simply because of COVID or because we are afraid of it. The PTF will continue to protect the health and safety of health workers, both in the public as well as the private sector. We are appealing to the private sector facilities to make sure they have adequate PPE to protect their staff. From the government side and from PTF, we will continue to engage with the private sector to train them on infection control processes. But PPE will primarily be given to public hospitals and to other frontline workers. We expect the private facilities to make adequate arrangements for their own PPE. If they are having difficulty accessing this, they should please get in touch with us and we can point them in the right direction. Having said this, we continue to thank our donor partners and our partners within the private sector, particularly the few that continue to provide excellent care to persons with COVID infection. The second issue I wanted to briefly mention is the issue of public sensitization. As you're aware, we are now pushing through the next phase of the response, which will be all about risk communication and community engagement. We will continue to work with all parts of the communities, religious leaders, traditional institutions, state and local governments, to make sure that that behavioral change we all need to adapt continues. We must learn to live with the new realities of COVID-19. especially as we are still far off from a permanent solution to the pandemic, such as the availability of a vaccine. All of us must take responsibility in protecting ourselves and others by adhering to the health protocols and lockdown guidelines while we go about our lives in this, what we call the new normal. Because post-COVID, things will not be the same. Finally, I wanted to again inform the public that the PTF has not been giving out contracts. The PTF is not a procurement body. We understand there are a lot of fraudulent letters going around trying to sell contracts to members of the public. So buyers beware. We are not signing off any contracts on behalf of the PTF. Thank you.
Thank you very much. That concludes the update segment. We're not taking any updates from the sectors this afternoon. We'll move straight to the questions session. Can we have our colleagues? Okay.
Good afternoon, sirs, members of the Presidential Task Force on COVID-19. My name is Yemi Adebayo from AIT. I just have three questions for the PTF this afternoon. And the first one, I remember clearly that on Monday, one of the guidelines passed, the SDF and the National Coordinator could respond to this. One of the guidelines contained in the second phase of the gradual easing of the lockdown issued on Monday states clearly that there will no longer be evacuation of Nigerians. That is, for now, it has been halted, and that for now there is no date yet that this will take place. Some Nigerians who are out there who are willing to return home, they are asking that the PTF could probably tell them a date when this exercise will commence again, due to the fact that countries around the world are making frantic effort to
of the task force, my colleagues. My name is Amaka Ode. I report for Arise News. And my first question actually is a follow-up to the new guidelines the DG spoke about earlier. I have seen the guidelines that you posted on your website, but there was one key part I feel that wasn't addressed there, which is the part of managing those that have been discharged from the isolation centers, even though they're still positive, but you've told us that yes, they might not still be viable to transmit the virus. So a guideline for their family members as to how they should manage them at home, especially if they still have some mild symptoms. Would need some clarifications on that. And also, in a bid to ramp up testing, the Lagos State government has actually started a validation process for rapid test kits. The reason I'm bringing this question to you is the fact that you have repeatedly told us, and even the health minister today said, rapid test kits are still not reliable. But for the Lagos State government, they said they need as much help as they can get. So what they've done now is they've actually gotten some people with the rapid test kits to go through some scientific process, which at the end of the day, they said they will get a NAFDAC registration number for them and they can use this test kit. So my question to you is, will the results from this rapid test kits that go through all the science process be taken by the NCDC? And my next question is for the National Coordinator, Dr. Sani. Well, Dr. Sani, since the beginning of the pandemic, domestic violence and sexual assault have been on the increase. And of course, recently we've heard all sorts of cases of people who lost their lives. Beyond even those who were either raped, we've even heard stories about women in labor who were turned back by security agents